All of us, at one point or another, have had the experience of waiting in a pharmacy waiting room for our prescriptions. But have we ever taken the time to ask ourselves, what exactly do the people behind the counter do, and what are the ins and outs of their jobs? I have had the opportunity to interview a pharmacy technician here in San Antonio, Texas, that works at University Hospital about her job and what she actually had to do to make it there. Ever since I can remember, I've had a great interest in becoming a pharmacist. So much that when I enter school in the fall, I will be a declared biochem major and hopefully will be on my way to pharmacy school very quickly and become a pharmacist. Felicia Fergoso is a 2006 Incarnate High School graduate, and as I said earlier, is a registered pharmacy technician at University Hospital. When asked about what sparked such a great interest in her, she said that she wasn't even interested in the pharmacy field until her junior year in high school, when the dean at the University of the Incarnate Word came to speak to the students about the opening of the pharmacy school right off Hildebrand. Immediately, she just became interested in both her chemistry classes and the thought of becoming a pharmacist, and when she applied for school, she declared herself as a chemistry major and is currently working to become a pharmacist. Of course, as all would be expected, her coursework is very rigorous. I asked her what she would use to describe her coursework, and the two words that she used were very intense. She said that she uses those around her, her peers, and those who attend her school as motivation to just keep going with what she has already worked so hard on. And that even though at sometimes it seems impossible, that in the end, with hard work and dedication, that it can be accomplished. Felicia's job title is a registered pharm tech, as I said earlier. Her job entails filling prescriptions, writing them, letting the patients know what exactly their prescription is, and also letting them know any precautions they must take while taking a specific medication. She puts the labels that everyone sees on their prescription bottles on, and as I said earlier, any precautionary labels that the patient needs to know about the particular medication. The patient isn't the only one who must take precautions while taking their medication. Felicia must take precautions every day when she walks into the pharmacy doors. She has to make sure that the proper medication is given to the correct patient, and also that the dose is correct when she distributes the medication out. This calls for her to recount the medication twice, 3, maybe even 4 times, and of course she must pass everything through the head pharmacist, who oversees everything and makes sure that there are very few errors. I, of course, was interested to see if Felicia had any advice to students like myself who wish to become a pharmacist. She said that just to keep up with schoolwork, because academics should be your #1 priority, because in the end, grades are what will make or break you. Pharmacy school is very competitive to get into, and even passing your test to become a pharmacist is not a very easy one. The test she had to take to become a pharmacy technician, she says, entailed a lot of science and math, and that all those tests require a lot of knowledge and preparation for. I was also curious to see if she had any suggestions for those, as I said, like myself, and she said, along with making academics your #1 priority, to engage in any jobs that might help you gain experience in that particular field, and volunteer work as well. I overall feel that my interview went very well with Felicia. I was glad I was able to interact and be able to interview someone who I I share common interests with, and someone who I look up to very much for their academic and job success. I hope to one day become a pharmacy technician so that I can gain the experience I will need for pharmacy school and eventually becoming a pharmacist.